Recent medical research has shed new light on a rare and often misunderstood sleep disorder known as sexsomnia, a condition characterized by unconscious sexual behaviors during sleep. As awareness of this disorder grows within the medical community, healthcare providers and researchers are working to better understand its causes, manifestations, and potential treatments. Understanding the disorder sexsomnia belongs to a category of sleep disorders known as non-rapid eye movement, NREM, parasomnias, which include various unconscious behaviors that occur during sleep. While sharing similarities with other parasomnias such as sleepwalking and sleep-related eating disorders, sexsomnia presents unique challenges for both patients and healthcare providers due to its intimate nature and potential legal implications. Recent studies indicate that the lifetime prevalence of sexsomnia reaches 7.1%, comparable to the occurrence rate of sleepwalking at 6.9%. However, unlike sleepwalking, which typically manifests in childhood, sexsomnia generally emerges during adulthood, adding complexity to its diagnosis and treatment. Clinical manifestations and presentations. The manifestations of sexsomnia can vary significantly among individuals. Clinical observations have documented a range of behaviors, from relatively mild expressions such as sleep-related sexual vocalizations to more complex actions, including attempted or completed sexual intercourse during sleep. Research has noted gender-specific patterns, with sleep-related masturbation being more commonly reported among female patients. Healthcare providers have also documented cases involving pelvic movements, unconscious groping of bed partners, and in some instances, aggressive or violent behavior. Perhaps most intriguingly, some patients report experiencing spontaneous sleep-related orgasms, highlighting the complex neurological mechanisms underlying this disorder. Diagnostic challenges and approaches. Diagnosing sexsomnia presents unique challenges for medical professionals. The condition requires a comprehensive evaluation approach that combines multiple diagnostic tools and methodologies. Initial assessment typically begins with thorough physical and psychiatric evaluations, supplemented by detailed interviews with both the patient and, when possible, their bed partner. Modern diagnostic techniques often employ video polysomnography, a sophisticated tool that helps medical professionals observe and document sleep behaviors while simultaneously monitoring various physiological parameters. This technology proves particularly valuable in differentiating sexsomnia from other sleep disorders or neurological conditions such as epilepsy. Advanced neurological evaluations, including electroencephalography, EEG, and functional brain imaging, have provided fascinating insights into the neurological basis of parasomnia episodes. During these episodes, researchers have observed an interesting paradox. While motor and limbic regions of the brain show wake-like activation patterns, the frontoparietal network maintains or even intensifies sleep-related activity. Thank you for watching. If you are finding this video helpful or enjoyable, I'd really appreciate it if you could hit the like button and subscribe to the channel. It helps support our content and ensures you won't miss future videos. Thanks for being part of our community. Risk factors and triggers. Understanding the risk factors and triggers for sexsomnia has become a crucial area of research. Studies have identified several potential contributing factors, including stress and anxiety have emerged as significant triggers, with researchers noting increased incident rates during periods of emotional distress. Irregular sleep schedules, particularly those associated with shift work or frequent travel across time zones, appear to heighten the risk of episodes. Poor sleep hygiene practices may also contribute to the development or exacerbation of symptoms. While genetic factors may play a role in the development of parasomnias, current research remains inconclusive. Family history studies suggest an hereditary component, but more extensive genetic research is needed to establish definitive links. Treatment approaches and management strategies. The management of sexsomnia typically involves a multifaceted approach, with healthcare providers generally favoring non-pharmacological interventions as initial treatment strategies. Current medical literature suggests several promising treatment paths, though formal practice guidelines have yet to be established. Behavioral and psychological interventions form the cornerstone of treatment for many patients. Hypnosis has emerged as one of the most frequently employed therapeutic approaches, often complemented by various forms of psychotherapy. Healthcare providers also emphasize the importance of sleep hygiene education, relaxation techniques, and mindfulness practices in managing symptoms. some patients benefit from more structured interventions such as scheduled awakenings or carefully planned nap schedules. Cognitive behavioral therapy, particularly when tailored to address sleep-related issues, has shown promise in helping patients manage their condition. Medication considerations. The role of medication in treating sexsomnia remains complex and somewhat controversial. While some medications may help manage symptoms, healthcare providers must carefully weigh potential benefits against risks and side effects. Importantly, certain sleep medications, particularly zolpidem, have been identified as potential triggers for NREM parasomnias, including sexsomnia. When medication is deemed necessary, patients should be clearly informed about the off-label nature of these prescriptions and potential side effects. Treatment of comorbid conditions, particularly other sleep disorders such as insomnia, often plays a crucial role in managing sexsomnia symptoms. Psychosocial and legal implications. The impact of sexsomnia extends well beyond its immediate physical manifestations. Patients often face significant psychosocial challenges, including strain on intimate relationships, emotional distress, and potential legal complications. The unconscious nature of the behavior can lead to misunderstandings and conflicts within relationships, requiring careful navigation and often benefiting from professional counseling. Legal implications can arise in cases where sexual behavior occurs without conscious consent, highlighting the importance of proper diagnosis and documentation. Healthcare providers must maintain detailed records and may need to provide expert testimony in legal proceedings involving patients with sexsomnia. Future research directions. The field of sexsomnia research continues to evolve, with several promising areas for future investigation. Researchers are particularly interested in developing more effective diagnostic tools and establishing standardized treatment protocols. The role of genetic factors, the potential impact of environmental influences, and the development of targeted therapeutic interventions remain active areas of study. Conclusions. Sexsomnia represents a complex sleep disorder that requires careful clinical attention and management. While our understanding of the condition continues to grow, healthcare providers must remain vigilant in recognizing symptoms, providing appropriate diagnostic services, and developing comprehensive treatment plans tailored to individual patient needs. The successful management of sexsomnia often requires a collaborative approach involving multiple healthcare disciplines and, when appropriate, legal professionals. As research in this field progresses, new insights into the underlying mechanisms of sexsomnia may lead to more effective treatment strategies and better outcomes for affected individuals. In the meantime, raising awareness about this condition among healthcare providers and the general public remains crucial for ensuring proper diagnosis and support for those affected by this challenging sleep disorder. Thanks so much for watching. If you enjoyed this video and found it helpful, we'd really appreciate it if you could give it a thumbs up. It really helps support the channel. And if you'd like to see more content like this, don't forget to hit that subscribe button and turn on notifications so you never miss out. Your support means the world to us. Consider clicking on the videos linked in the corners if you want to watch more.